Good afternoon or good morning, depending on where you're joining us from today. My name is Bob Gerlach. I am the Health and Wellbeing Benefits Manager here at WestPath, and you were invited to this webinar because you are in the H1500 plan today. And so I'm going to be talking about the changes between the H1500 plan today and the plan that is most closely resembles that plan next year, the H2000. So if you're not in the H1500 plan today, this might not be the webinar for you, but you can still feel free to listen in and ask any questions you may have. Today I'm going to talk about the 2024 HSA plan changes. We are changing all of the HealthFlex HSA plans for 2024. Want to make sure you confidently understand how the new plan compares to your current plan, and then also want to make sure that you feel prepared to make your 2024 HealthFlex selections. You might be asking why we're making changes. In 2023, the IRS minimum deductible for an HSA plan was $1,500 or $3,000. In 2024, they've made the change that the minimum deductible will be $1,600 for an individual and $3,200 for two or more people. Therefore, if the H1500 remained the same for 2024, it would be not compliant. The changes we've made across all plans for 2024 should avoid the need for us to make further changes year over year and still allow us to have a package of plans that are beneficial to those people currently enrolled in HSA plans and those looking to enroll in HSA plans in the future. We've designed the new HSA plans to align with the needs of participants on the current plans. As I said, this webinar is for those currently in the H1500 plan, so I'll talk about the differences between the current H1500 plan and the new H2000 plan that will be in effect in 2024. If you look at the differences between the H1500 plan and the H2000 plan, we'll start with the family deductible and the individual deductible. The H1500 today, like the number in the name, has a $1,500 individual deductible and a $3,000 family deductible. Beginning in 2024, we will replace the H1500 with the new H2000 plan, and that plan will have a $2,000 individual deductible and a $4,000 family deductible. The coinsurance remains the same at 80%, and the individual and family out-of-pocket max also remain the same at $5,000 per individual and $10,000 per family. The HSA contribution is actually increased in 2024, going from $750 for an individual or $1,500 for a family to $1,000 for an individual or $2,000 for a family. Based on all these changes, the H2000 will be a gold plan offering of an HSA plan type in 2024. We believe that this will be the best plan for people currently in the H1500 plan who want the plan that closely resembles the one they have today. It's also a good option for people who are ready to try an HSA plan but nervous about a higher deductible. As I said, we will have more HSA funding included with the H2000 versus the H1500 plan. And that helps to offset the increase in deductible that the new H2000 has over the H1500. And again, to summarize, the coinsurance will remain at 80% and the out-of-pocket max will also remain the same. And please note, the H2000, the new H2000 in 2024 is not the same as the H2000 that we have today. Let's take a look at a couple cost comparison examples so you can see how the plan may pay a little bit differently when we move from the H1500 to the H2000. So here's an example of a cardiology outpatient visit with testing. The discounted cost of this service is $1,500. In the H1500 today, for employee-only coverage, there's a $1,500 deductible and $750 in account funding. The total participant cost of this service today would be $1,500 because in an HSA plan, you pay the full discounted cost until you meet the deductible. In the H1500, a $1,500 service will take you all the way to the deductible. So your total out-of-pocket cost in the H1500 for this service would be $1,500 minus the $750 that's in your HSA. So you would pay $750 out of pocket. In the new H2000 plan, also with employee-only coverage, there is a $2,000 deductible and $1,000 in account funding. So in this scenario, the $1,500 does not meet the full deductible. So you pay $1,500 and then have $500 left to pay towards your deductible. So that means you pay the $1,500 plus the $500 to meet the deductible. But in this case, you have $1,000 in health account funding, which offsets the $1,500 that you have met. So you've paid $500 out of pocket, and you still have $500 until you meet your deductible. Let's look at another example, a more expensive example, an appendix removal. The discounted cost of this service is $6,000. We will still look at employee-only coverage for both examples. In the H1500, you have a $1,500 deductible to be met and $750 of account funding. So your total cost is $2,400. That is $1,500 to meet your deductible, and then you are responsible for 20% of the remaining amount after the deductible, or $900. The cost of the service to you is $2,400 after meeting your deductible and the plan paying its coinsurance, but your total out of pocket is only $1,650 because you can reduce the amount you're paying by the $750 that's in your HSA. If we look at the H2000 in 2024, there's a $2,000 deductible, $1,000 in account funding. So in this scenario, you pay $2,800 for the service, $2,000 to meet the deductible, and then 20% of the remaining $4,000. But when we look at your total out-of-pocket cost, it drops to $1,800 because your $2,800 that you paid, you will pay $1,000 from your health savings account, the $1,000 that's built into the plan. Now I want to take a few moments to explain the differences and similarities with prescription drug coverage between the H1500 of today and the new H2000 in 2024. The first example that I will go through is for generic non-preventive medications. In an HSA plan, you pay the full discounted cost of a medication until you meet your deductible. This prescription drug we're looking at is a generic drug where the discounted cost is $110 for a 30-day supply and $330 for a 90-day supply. In the old H1500, so the gold HSA plan of today, you would pay $110 for a 30-day script or $330 for a 90-day script, the full discounted cost, until you meet your deductible. In the H2000, you would pay exactly the same, $110 for the 30-day script, $330 for the 90-day script, again, until your deductible is met. However, in the case where your drug is on the preventive drug list and the cost is the same, the full discounted cost is the same, because your prescription drug is on the preventive drug list, you bypass the deductible and pay the copay amount that you would pay if the deductible had already been met. So in the H1500 today, that means you pay $10 for a 30-day script and $25 for a 90-day script. And in the new H2000 in 2024, you would also pay $10 for a 30-day script and $25 for a 90-day script. You can find the full list of preventive drugs online at welcome.optumrx.com/westpath or by logging into benefitsaccess.org and going to the HealthFlex section. Let's now look at a preferred brand drug. These are drugs that are more expensive than generic drugs, but less expensive than other brand name drugs that are available. So for this example, we'll look at a prescription drug that costs $267 for a 30-day script or $726 for a 90-day script. And again, this is the discounted cost of the medication. A similar story to non-preventive generic drugs where you pay the full discounted cost of the drug before you meet the deductible. And that is the case in the H1500 today and will also be the case of the new H2000 in 2024. But similar to the generic drug example where the drug is on the preventive medication list, you pay the cost of the drug, the copay of the drug, as if the deductible had already been met. For preferred brand drugs, you pay a 30% copay, but then we apply minimums and maximums. In this scenario, due to the cost of the drug, you would pay the maximum cost of the drug. That is $65 for a 30-day script or $165 for a 90-day script, and the cost is the same next year in the new H2000 plan. We feel that there is a lot of wisdom for a vast majority of people in choosing an HSA plan. The first thing we want everyone to remember is that a higher monthly premium does not necessarily make a plan better. Each plan covers the same quality and the same services. And our analysis over the last several years have shown that over 90% of people save money in an HSA plan over one of the other plan types. So if you want to save money in 2024, and you are looking to change plans or looking to buy a lower cost plan, we want to make sure you always consider the amount of money you pay each month in premiums for the plan when you look at your total out-of-pocket costs. You can look at past medical services by checking out your explanation of benefits or EOBs on your medical provider site to help plan for what your expenses might be in the upcoming year. But you can also use tools like Alex, who are going to estimate what the costs of services would be across all plans based upon the information that you provide as to what your likely utilization will be in 2024. Additionally, Alex is going to give you a recommendation on the amount of money you should consider putting into a health account, whether that be an HSA or in some cases an FSA, to make sure that you're maximizing your benefit and maximizing your tax savings. And if you do have premium savings by choosing an HSA plan over another plan, we recommend you consider taking those premium savings and putting them into your HSA. We saw all the examples that showed how, whether it was medical or pharmacy, you need to meet your deductible before the plan pays. So in HSA plans, that means that you are paying more money up front for services than you may pay in other plans. And by putting your premium savings aside, that helps you be ready to make those payments and pay for those services. For more information about HSA plans and all the other offerings in HealthFlex, you can log into your Benefits Access account and see a number of different Benefit Bite videos, plan comparisons, cost estimating tools, and your personalized Alex link. All Benefits Access modules across HealthFlex have been updated with 2024 plan information. Additionally, Benefits Access will be the place that you go to make your elections beginning on November 1st. As I said, HealthFlex annual elections begin November 1st and go through November 16th. Since the H1500 plan will not be available in 2024, if you do not make any elections, we will automatically move you from the H1500 to the H2000 to guarantee that you have coverage in 2024 and to assure you that the coverage is as close as possible to the enrollment you have today. If you have dental or vision elections, those will remain the same. But if you want to make personal contributions to either an HSA or an FSA, you do need to log into Benefits Access and make those yourself every year. At this point, I have covered all the changes between the plans that we have prepared for you today. If you have any questions, please feel free to type them into the questions module or to take yourself off of mute and ask those questions. We have about 30 minutes of time to take questions.
What is the maximum contribution for an HSA this year?
Okay. The maximum contribution for an HSA for an individual is $4,150. For a family, it's $8,300. And if the primary participant is over age 55, you can contribute an additional $1,000 on top of that, bringing the total for an individual over age 55 to $5,150, and to a family where the primary participant is over age 55 to $9,300. And note, this amount includes any money that's built into the plan. So for the H2000 next year, if you have individual only coverage, you need to reduce the amount you can contribute by $1,000. And if you're covering 2 or more people, you would need to reduce the amount you can contribute by $2,000. As you are thinking of questions to ask, if you would like to keep your questions more anonymous, please note that we will be sending out the recording of this webinar to you in the coming days, and you could reply to that message with a more sensitive question, and we will get back to you. Okay. At this point, we do not see any more questions that have come in, so if you think you have entered one, please check and feel free to type that in again. Okay.
Why are you not qualified for an HSA plan once you turn 65?
The question is, why are you not qualified for an HSA plan once you turn age 65? This is due to regulations that WestPath and HealthFlex need to comply with, but have no control over them. It has been determined that if you are enrolled in Medicare or taking Social Security, you cannot make contributions, nor can the plan make contributions on your behalf to a health savings account. If you are over 65 and have not yet taken Social Security and have deferred both Medicare Part A and Part B, you can contribute to an HSA, but we highly recommend that you speak with a tax advisor. You can certainly contact EY for more information about that and to determine if that is the right step for you to take.
What do you recommend for those who cannot contribute to an HSA because they're over 65?
So if you are over age 65 and cannot contribute to an HSA, I would first speak with my tax advisor to see if that plan still may be the correct plan for you. It is possible, although unlikely, that an HSA plan with no ability to contribute to an HSA may still be your best option. But if you would like to explore one of the other plans, we have the B1000 plan, which is a traditional PPO, and we have 2 HRA plans, the C2000 with HRA and the C3000 with HRA. We have found overwhelmingly that the HRA plans are the most cost-effective plans for people who cannot make contributions to an HSA. This does not mean that it is guaranteed that it is the best plan for you, just that the highest percentage of people who do not contribute to an HSA would find the lowest cost in either the C2000 with HRA or the C3000 with HRA. The other consideration for enrolling in an HSA plan would be when you are turning age 65. If you are still considering an HSA plan in 2024 because you're in one today, you would want to pay attention to how many months you would be enrolled in the HSA plan, because the maximum you can contribute is prorated by the number of months that you are eligible to make contributions. So if you are going to be in the HSA plan for 6 months and eligible to contribute for 6 months, you would reduce the maximum contribution by 50%.
Okay, got another question. If you know you are going to need an MRI annually, how do you decide which plan is best?
If you know you're going to need an MRI annually, how do you decide which plan is best for you? I mean, first of all, what's really great is that you know you're going to need that service, so you can figure out what the price point is for that service. When I am looking at what plan I should choose for the next year and I have known services or known treatment that I'm going to need, I look at what that service or what those services would cost before I meet my deductible. In many cases, an MRI, you're going to need to meet your deductible first. So that is money that you're going to have to be prepared to pay out of pocket or through a health account contribution until you meet your deductible. And then when I look across plans that I'm going to choose or choose between, I would see what the premiums for those plans are. Because for many people, the premium you pay each month is the most expensive part of healthcare coverage. And then I would use Alex to see what Alex recommends for services. You can probably find a good cost estimating tool online to see just what an average MRI costs. And then lastly, what I would recommend, regardless of which plan you choose, is to figure out where you're going to get an MRI for the lowest cost. Imaging machines are largely the same no matter where you go for the service. And if you find a freestanding imaging clinic, you're going to pay much less there than you would at the ER, for example. Okay. While we wait for the next question, I also want to point out something that I did not bring up on this call, but that you will hear about in the coming weeks, and that is care coordination that is coming to HealthFlex in 2024. Care coordinators are going to essentially be your family member, distant family member maybe, that helps you navigate through healthcare. So once January 2nd hits, because I think that's the first business day of 2024, if you know you need an MRI, you can contact the care coordinator, and one of the many services they will provide is they will help you find the lowest cost provider of that service.
Where can people find information about the cost of the plans for 2024?
Okay. So if you have questions about the cost of the plans for 2024, you should reach out to your plan sponsor. They will be able to provide you with the rates and what the offset of their premium credit is, if any. For those who are participants through an annual conference of the United Methodist Church, those are available for the most part on the conference websites, but you could also reach out to your conference benefit officer. If you are not active clergy of a United Methodist annual conference, you should reach out to your human resource department, and they will be able to provide you with that information.
There's some typing happening. Primary participant is turning 65 in November of this year. Spouse is also clergy and only turning 64, but retiring this year. Can we still set aside an HSA?
Okay, so participant is turning 65 this November. I'm thinking you mean November 2023, which means as of November 1st, you will not be able to make contributions to the HSA. It also means that for 2023, your maximum contribution is 5/6 of the contribution, right? Because you can contribute for 10 out of the 12 months in the year if you're moving to Medicare. Starting next year, would your spouse under age 65 be able to contribute to an HSA if they enroll in an HSA plan? The short answer to that is yes. As long as they are not taking Medicare, as long as they are not enrolling in Social Security, they can contribute to an HSA for X number of months divided by 12 for which they are eligible. They will not be able to make contributions through your payroll withdrawals as you could today. They would need to reach out to Health Equity directly and make contributions to them and then claim those contributions on taxes in the following year.
If you anticipate leaving your job after 6 months, but the HSA money is contributed to your account in January, does $500 need to be returned after 6 months? Or is the $1,000 paid in January yours to keep?
It's a good question. So the money that is built into the HSA plans is your money to keep as long as it does not exceed the limit for you for that year. So when we look at a $1,000 contribution that's built into the plan in January for an individual person being covered, that money is yours to keep as long as it does not exceed the limit that you can contribute. So if you're only covered for 1 month out of the year, $1,000 is much more than 1/12 of $4,150 if you're over 55, right? Or I'm sorry, $5,150 if you're over 55, or $4,150 if you're under 55. It's only in those scenarios that you would need to request that money back. But let's say the $1,000 is there and you're covered in the plan for the 6-month example, then yes, that money is yours to keep because it will not exceed the maximum contribution you can make to an HSA for that year.
What happens to the HSA if you switch to an HRA plan like the C2000 or the C3000?
Okay. If you have money in an HSA today, it is yours to keep and spend as you wish, no matter what plan you move to. But you will not be able to continue contributing to an HSA. So that balance will remain. You can invest that balance if you choose. If you have at least $1,000, you can invest it. But you can continue to use that money to pay for your healthcare services, and you can enroll into an HRA plan and receive the account funding built into that plan and use them both. But you will not be able to contribute to the HSA anymore.
Can someone increase their 2023 HSA personal contribution in anticipation of having a higher deductible in 2024?
Okay. You can increase your HSA contribution at any time. You would need to contact your benefits officer or HR department to make that change to ensure that it comes out of your paycheck. The other option is that you can put money directly into your HSA by contacting Health Equity, and then you just need to claim that money on your taxes to get the full tax benefit. The other thing you can do is, let's say you have an unexpected expense. Let's say it's February and you found out you're going to have some surgery in March that you have money put aside for, but it's not yet in your HSA. You can deposit that directly into your HSA so that you have it to pay for that service. But you will again want to make sure to remember to claim that on your next year's taxes to get the full tax benefit. And you also need to make sure that whatever you're contributing, whether it's the money built into the plan, your monthly contributions to the HSA, or any one-off contributions directly with Health Equity, do not exceed the IRS limit for the year.
I'm just waiting for a couple more questions.
Sure.
What happens to HSA balance if you are no longer eligible to contribute to the HSA in 2024?
Once you have an HSA balance, unless money was deposited in error, that money is yours to do with as you will. You carry it through to retirement, and once you are retired, you can continue to use it for medical services, or you can take a withdrawal in retirement and only pay normal taxes and use that money for whatever you would like.
Waiting for more questions. If you're not eligible to contribute to an HSA, can they contribute to an FSA?
If you are not eligible to contribute to an HSA, you can contribute to an FSA as long as you meet the requirements for that. Some scenarios where you are not eligible to contribute to an FSA would be if you are not receiving a paycheck. So if you are retired and enrolled in a plan, regardless of the HealthFlex plan, you cannot contribute to an FSA because you are not receiving a paycheck as an active employee.
Okay. What happens to the premium credit if it is more than the premium of the plans you elect?
In the scenario where your premium credit is more than the sum of the medical, dental, and vision plans that you select, that excess premium credit, as we refer to it, is automatically deposited into an HSA if you are eligible to make contributions to the HSA and have accepted terms and conditions, or it is deposited to an HRA. So you do not lose that money. That money gets deposited monthly, and you can use it to help pay for your expenses.
It's like something else is coming. If we don't have a lot of expenses, is there any benefit to not using the HSA money for basic medical expenses and instead saving it for future health issues?
So you do not need to use the money in your HSA if you do not want to. So if you have limited expenses, so for example, if you have a year where maybe you have a couple people in your household get sick and you just have to buy some antibiotics, 30-day scripts, and you're going to spend, I don't know, $30 in medication, and you'd rather pay that out of pocket and maximize your HSA and not touch that money, you can certainly do so.
I'm just holding for more questions. Nothing yet.
So while we are waiting for more questions, I'll give a quick plug to a couple upcoming webinars that we have scheduled. This Thursday, we will have a webinar focusing on AE overall. So while this one was laser focused on people currently in the H1500 plan, there will be a webinar later this week that is open to all HealthFlex participants, talking about all the different plans we have to offer in HealthFlex. Additionally, during annual election, for the first time, we're going to have a webinar that is really just an open Q&A. So if you have questions when you're going through AE, if you have additional questions or thought of something that you forgot to ask today, you can certainly join that webinar and ask questions at that time as well.
We have another question. How is the plan contribution handled for tax purposes? Is it considered income?
So the plan contribution, I believe, is referring to the money built into the plan for the HSA, the H2000 for next year, that's available on day one. That is considered in the category of an employer contribution, which means that it goes into your account on a pre-tax basis. It is not recorded as income, but it does offset the IRS max for HSA contributions for the year. So it will be reported on your W-2 in box 12 as the total amount of contributions that went into your HSA, but it is not anything that you will have to pay taxes on, nor is it something that gets reported as income.
Looking for more questions? Something coming through. What happens to the HSA balance once you are retired? Can you use it to pay Medicare premiums?
Once you're retired, the HSA balance remains yours. Even in death, you can leave that HSA balance to a beneficiary. When you're retired, that money can continue to be used for healthcare services. You can also use that money to help pay Medicare premiums. And as I said earlier, you are not in retirement restricted to only using HSA monies for healthcare expenses. You can take just a standard distribution, pay normal taxes on it, whatever tax bracket you're in at the time, and use that money for any expense you'd like.
How do you register for other webinars?
It's a good question. We have a number of webinars available on the HealthFlex Benefits Access page. So the best thing to do would be to log into benefitsaccess.org. I believe the top banner right now has a Learn More button for HealthFlex Annual Election. If you click on that button, you will be able to see the webinar links.
Holding for more questions? Is Alex currently available?
Alex is currently available and has been updated with costs and plans for 2024. So if you log into your Benefits Access account and you're currently in HealthFlex today, you will be able to see a link to Alex and you can start getting an estimate on what might be the best plan for you in 2024. Please remember that Alex does not make your elections for you. So if you go through Alex today, I recommend saving or even printing, if anybody does that anymore, the recommendation. So when you log in on November 1st through November 16th, you'll already know which plans you want to elect.
Waiting for another question? No other questions.
Okay. We have about 5 or 6 minutes left. Looks like no questions coming in right now. Did want to remind you there will be plenty of other opportunities to ask questions. Thank you so much for asking questions and for joining us today. Please be on the lookout for invites for other webinars. And then, as I mentioned briefly, look for information in December and January about the new care coordinators that we're introducing to HealthFlex for 2024.
We're wrapping. If you
Okay.
want to just
All right.
sign off again.
Thank you, everyone, for joining today. I appreciate all the questions and your attention. Please be on the lookout for annual election information. Please go online and make your elections November 1st through November 16th. And I hope everyone has a great day.